Technically, the definition of sleep apnea is when you stop breathing for longer than 10 seconds. For many people who have sleep apnea and they have the more severe stages of sleep apnea, that could translate into waking up 20, 30, 40 times an hour during a night. So it disrupts your sleep, so you're tired. It affects your whole body as far as the chemicals that your body needs and the sleep that your body needs. So it's becoming much more of an issue for people, and it's becoming much more noted in the press and in general medicine. Well, the human body has to have sleep. They can't function without it. And it affects its depression, anxiety, heart, lungs, gastric reflux, all those things are affected. So we can help our patients feel a lot better by treating their sleep apnea. Well, usually people are tired because they're not getting a good night's sleep. They're waking up in the middle of the night, catching their breath, or they're getting out of their REM sleep, which is the important sleep. And so they're very tired. They wake up in the morning and they're tired, and they might fall asleep in the afternoon at lunch or something like that. But it's mainly how they're feeling and if they're tired and that. Snoring is a symptom. Doesn't necessarily mean the patient has sleep apnea if they snore, but it generally makes you start thinking that that might be a possibility. So how do you find out if a person has sleep apnea? You can't pick it up just by walking down the street. Everybody is a possible candidate to have it, and it mainly is about their anatomy, the way their airway is, if they have a narrow airway, if they've got a bunch of tonsils and other soft tissue in their airway, that can close off the airway and they're more susceptible. But again, you really just can't tell unless you do the test. And so there's a home sleep test now that's available that you can do in the comfort of your own home. You don't have to go check into one of the centers or anything like that. So really the only way to know if you have sleep apnea is to get the test. There's 3 common ways that sleep apnea can be treated. One option is surgery. That's always our last option because it's not predictable, it's also expensive, and it's a pretty big procedure. That leaves us with 2 other options. One is the CPAP, and most people are familiar with the CPAP because it's a big machine that straps to their face. It's like putting a scuba mask on, and it's uncomfortable, and patients just don't like it. It's not simple. You have to fool with it, do distilled water. It's hard to travel with it. All of those things make it not very popular, and people have trouble wearing the CPAP. So that leaves us with the option that we can deal with, what dentistry can do, which is an oral appliance. In the oral appliance, most people are familiar with CPR. And the very first thing they teach you in CPR is to open up that airway, to pull that chin up. So that's kind of the principle of what the oral appliance does. It pulls your lower jaw forward. It pulls your lower jaw out about as much as if you were biting into a sandwich. And it pulls your lower jaw forward and keeps that airway open. And if you keep the airway open, then people don't gasp for their air in the middle of the night.